Hey guys, dandruff affects about 50% of us and it can really knock your self-confidence. You usually have an itchy scalp or you might have some skin flakes. So in this week's video, we're going to be learning about how to treat dandruff, we're going to be learning about the symptoms, and we're going to be learning about other conditions that it could potentially be and when to seek medical attention. So first, let's begin with some lifestyle tips that can really help with dandruff, and then we'll move on to the treatments. I thought I'd do it in this order because obviously you're going to be able to do these straight away, whereas the treatments you'll probably have to go to a chemist and purchase them. So moving on to tip number one, are you shampooing enough? And what I mean by that is, are you really getting into the scalp and are you creating foam and leaving it in there for it to work? The reason I'm saying this is if you have an oily scalp or if you use any hair products in your hair, you really need to lather up the shampoo and also get that foam going and get it into the scalp really so it can work and it can break down those oils and get them out of your hair and scalp. By doing this properly, you should start to see some good results with the dandruff. And whilst we're on the topic of hair gel and hairsprays and things like that, sometimes using fewer of these products can really help with dandruff as well. So you could potentially try using less or switching brands or not using it at all. If you are going to be using hairspray or hair gel or any sort of hair products, please try and use alcohol-free ones, as these can also help with dandruff. And whilst we're on the topic of using different products, another product that you could potentially use is a different shampoo. For example, baby shampoo is probably the most mild shampoo that you can get, and it's far less likely to irritate the scalp and dry the scalp. Also, you could potentially invest in a good scalp moisturizer. This is again going to help with that dry scalp and it might help with the symptoms of dandruff as well. Okay, so moving on to tip number two, the next thing that I want to talk to you about is stress and anxiety. Yes, stress and anxiety can make dandruff worse. You may have noticed it. You may have noticed it when you've got exams or you've got deadlines. Your dandruff becomes worse, it becomes far more itchy, and it's known that these can make dandruff worse. So you need to learn and develop some techniques to relax, to reduce your stress, to reduce your anxiety. And the good news is that I have quite a few videos on this topic already, which I will leave links to up here and in the description below, so feel free to check it out if you want some help with it. Moving on to tip number three, you may have noticed that during the winter your dandruff might get worse, and the reason for this is that cold weather can make dandruff worse. The science behind it is that cold scalp, you get less blood supply to the scalp and it's more likely for the dandruff to become worse. So what you need to do is try and keep the scalp warm, and that's going to get more blood there and it's potentially going to help reduce those dandruff symptoms. So the options that you've got really is you can grow your hair out a little if you've got short hair. You can grow your hair out so that it insulates the scalp and keeps you warm. You can also try and wear a hat now and then, that'll keep it warm if you're going out. So these are potentially things that you can do. Now let's move on to tip number four. It's all about those vitamins and supplements. First of all, if you are having a healthy balanced diet, you don't need to go out there and buy any supplements or vitamins to help with your skin and nails and hair and all that sort of stuff. All you need to do is follow a healthy balanced diet. The vitamins that are good for your hair and good for your scalp are vitamin B, zinc, and also omega-3. But again, if you're having a healthy balanced diet, you don't need to go and supplement with these. And if you're thinking, what's a healthy balanced diet? Well, it's going to take about 15 minutes for me to go through that in this video, and I'm sure a lot of you don't want that. But if you do want to find out more about how to have a more healthy balanced diet, I do have quite a few videos on it again, which I will leave a link to up here and in the description below. Feel free to check it out. And tip number five, make sure that you are hydrated. Make sure that you drink enough water. So it's 6 to 8 glasses of water every day. That's about 2 liters of water every day. Make sure you're getting enough hydration because that's going to keep that scalp nice and hydrated and reduce the dandruff symptoms. Okay, so that's the lifestyle tips. I really hope that you found them useful. Now let's move on to those medical treatments. So you've tried the lifestyle tips, you're not seeing much benefit from it, or you're already doing all the stuff that I've discussed, so we can try some medical treatments. Before we start going through them, I just want to say, please give it time, these treatments. Give it at least a month before you start seeing some real effects. And you might have to try different products, so bear that in mind as well. Now let's begin. Okay, so here's a quick science lesson. Here is how dandruff happens, so how it works. There's a fungus on everyone's scalp called Malassezia globosa. This Malassezia globosa fungus creates a fatty acid, which we call oleic acid. And this oleic acid causes that irritation on the scalp, which then causes dandruff. That is it in a nutshell. So what we try and do with this Malassezia globosa, this fungus, is we want to try and use an antifungal shampoo. One of which, for example, is ketoconazole shampoo. It works really well for dandruff. It works really well at killing that fungus. You usually apply it twice a week. You might have an increased dose and then reduce it, but that is just generally how it works. You might want to speak to your pharmacist about it for more information as well, or your healthcare professional. But the way it works is you're going to lather it in, you're really going to sort of rub it into the scalp, leave it on for at least 5 minutes before you wash it off. And like I said, it's usually twice a week. You might use it 3 times a week to begin with and then reduce the dose down slowly. But I do have a video all about ketoconazole shampoo as well, and going through it in detail how you would increase the dose and reduce the dose. So if you do want more information on that, I'd highly recommend you watch that video, which I'll leave up here and in the description below. Now the next shampoo that I want to discuss, let's say ketoconazole doesn't work, is selenium shampoo. Selenium shampoo, again, is a type of antifungal that kills the fungus as well. So if the ketoconazole hasn't worked, you could try selenium. Again, you need to speak to your healthcare professional about it before you purchase it to make sure that you're safe and suitable to use it. This applies for ketoconazole as well, because the most important thing is your safety. There's also zinc shampoos, again, that kill bacteria and fungus. So again, this could be a potential option if the 2 that I spoke about just now haven't worked. Now the next shampoo medical treatment that I want to discuss doesn't kill the fungus, but what it does is it reduces the rate at which the skin cells on the scalp reproduce and keep on making new ones. So sometimes it can go into overdrive, this reproduction of the skin of the scalp, and that's usually seen in like psoriasis patients, for example. And a good shampoo for that is coal tar. So the coal tar reduces how quickly those skin cells reproduce themselves. And with psoriasis, you do get dandruff symptoms as well. You get a scaly scalp, and also you get the flaking as well. So if that applies to you, coal tar shampoo might be more useful. Now if you have scaly skin on your scalp, a salicylic acid shampoo could be more useful, and the way this works is it just breaks down the skin cells where you're applying it, and it can be really useful for this. Okay, so let's now move on to the causes of dandruff. First of all, please remember this: dandruff is not contagious. It's not because you're unhygienic or anything like that. So please don't listen to anyone who says that to you. This is absolute nonsense. Dandruff is not caused by anything like that. So let's talk about what actually causes it. So the first thing that I want to talk about is age. Age can be a considerable factor that causes dandruff. Usually people get it when they're a young adult, and it continues as they get older. This is why it's so important that we treat it quite early on to try and stop those symptoms from progressing. And I'm so sorry guys, but unfortunately men are far more likely to have dandruff than women, and this is all because of our hormones that are potentially causing the dandruff symptoms. And having a condition that affects your nerves, for example Parkinson's disease or HIV, can also make you more likely to have dandruff. Another thing that I want to discuss is having a weakened immune system. So this can be caused by various reasons. For example, lifestyle factors could be causing it. Also, if you're on immunosuppressants, if you're on any medicines that are causing it. So this is also something that could potentially cause the dandruff as well. Now there can be other causes as well for dandruff. For example, eczema, psoriasis, contact dermatitis, and even head lice. So if you do think you have any of these kinds of symptoms that potentially indicate these, which I will leave more information in the description below, please do speak to your healthcare professional about it. And whilst we're on the topic of speaking to your healthcare professional, look, if you've tried the lifestyle stuff that we've discussed, if you've tried the medical treatments that we've discussed, the shampoos, if you've given it a month and you haven't really seen any benefit, then please do speak to your healthcare professional. Don't just leave it. And if your scalp is red, swollen, yellow, crusty, or very itchy, please do speak to your healthcare professional about it. So it looks like we've reached the end of this week's video. We now know all about dandruff, what causes it, lifestyle factors that can help with it, medical treatments, and when to seek medical attention. So you're a bit of a dandruff pro, so tell your friends, tell your family, tell your loved ones, tell everyone, because you now know about dandruff. I really hope that you found this information helpful. I'm now going to go film some B-roll in Greece, but as I always say, sending you all awesome vibes, and I will see you next week. Hey guys, thanks for watching this week's video. Make sure to click that like, follow, or subscribe button now to stay up to date with new weekly videos.